Hey, Jules the Doula here, welcoming you to the Virtual Mama Connection. Listen in with me every week as we bring you birth stories and experiences straight from our parents' hearts, always providing you a lifeline of education and communication, keeping you ahead of the game with the best care providers and educators. And just a little reminder out there, anything you hear on our podcast is not to be used as medical advice. Please visit our disclaimer on thevirtualmamaconnection.com. Hey, Jules the Doula, back again this morning with Kim Bryant. Great segment. I can't tell you, Kim, how many times I hear moms say, Jules, should I wrap? Or is that okay? So this segment with Kim Bryant with Thrive Pelvic is all about to wrap or not to wrap. What do you say about that, Kim?
It depends. I know no one's going to want to hear that, but it depends. There's, with so many things postpartum, there's not, in this case, it's not or black or white. It really depends on the situation. So, a little bit about me just to share with your audience. I started Thrive Pelvic Health and Wellness about 5 years ago here in the Phoenix area. And because I felt like there was such a huge disservice for pelvic health. And that goes across the gamut for fertility, pregnancy, postpartum care, and beyond. And just recently, we started our Thrive Pediatrics.
Tell me about that.
Yeah, so we do general pediatrics. So that's gross motor milestone delay, tongue tie revision, torticollis, all of those things that I feel like we might see in the clinic, having like children that are having issues or challenges with breastfeeding. Sure. But then we also offer pediatric pelvic floor as well. Wow. So that might be something with like having challenges with toilet training. We see, unfortunately, a lot of constipation and withholding if children are having some difficulties with using the restroom or fear of using the restroom. And then also that corresponds with bedwetting. So I was super excited to be able to offer those services starting this year. So, and those are all in person and online as well.
That's awesome. You guys, you just kind of do everything with the pelvic floor, don't you?
Yeah. I mean, it's, like I said, it's such an underserved population.
It is.
I'm going to, my mission is to, for those days when people are coming into the clinic or calling the office and not saying, I have been searching for you for years. Mm-hmm. And so I'm going to just keep expanding, keep providing and educating about the role that pelvic floor physical therapy can have until people know about us, so they don't have to search anymore.
That's great. And you know what? I never even really thought about that with bedwetting, but how much does that play into it? Probably a lot with the child's pelvic floor, right?
Absolutely. It usually is probably the number one factor is constipation. It's a unfortunate domino effect of, okay, maybe they had one bout of constipation or a painful bowel movement. So then they don't want to have a bowel movement. So that gets to holding. And then their bodies are just so tiny. So it's like a little backup, sure, within the colon. And then that puts pressure on the bladder. So then at night, even if they go to the bathroom before they go to bed, at night, there's just so much pressure within the pelvis that can lead to overnight leakage.
Wow. Oh, I'm so thankful you're here. Yeah. Well, I tell all my mamas to come see you before they have a baby. So now, it's amazing. People continue to reach out to me after they have had babies. I had a family reach out to me recently. They have a 4-year-old on some other issues, but this way it's good for me to hear this. I learned so much on these podcasts. You guys educate me all the time, and here I'm learning something new. I know we're going to be talking about to wrap or not to wrap, but I really wanted us to hear about your the new pediatric pelvic, floor help that you can provide all our families here in the Valley or virtually. So that's great.
Yeah. And as always, thanks for having me on. I really appreciate it. And we always have a lot of fun.
We do. We do.
Yeah.
Fun. We have fun and we learn. So that's great. Well,
Yes.
so tell us about this, to wrap or not to wrap. Give us the down low.
Yeah. So as hopefully most everyone knows, there's a lot of changes physically, emotionally, hormonally that our bodies go through during pregnancy. Our rib cage kind of flares and opens up. Our pelvis has to arch and open a little bit. Our abdominal wall gets very overstressed and strained. And also our pelvic floor is under stress. So there's a lot of changes that our bodies go through just throughout pregnancy. And then into postpartum, I feel like it's really important for us to reestablish that balance within our system with our posture, our breath, our movement, our muscles, so that you can have a strong foundation moving forward. I want there to be a stop or a decrease in those women that are dealing with painful intercourse or leakage for 2, 5, 10, 15 years postpartum. If we can look at these things and reestablish a good foundation initially, it's going to make it that much more stable to move upon later on in life. So I think it's really important, even if you had the best birth ever, to come in and have an assessment done. And that abdominal wall is what we're going to, and kind of pelvis is what we're really going to talk to in regards to whether or not to wrap or not. So there's a few different reasons why someone might choose to wrap or bind their waist and abdomen. So one might be more of a ceremonial type energetic reason. There's the idea that there's a lot of energy that gets utilized during birth, during pregnancy and birth, that things are left open. And so the binding can help to close down that energy, control that energy, and just create a comforting space for our womb. Another reason someone might want to utilize a wrap or support or bind is for just weakness, like they just feel unstable. There could also be for diastasis recti or DRA or DR. That's when the rectus abdominis muscle, that six-pack muscle, can be overstretched. By the end of that third trimester, some studies show that up to 66% of women will have that separation, but there's some newer research out there that says that almost 100% of women will have that stretching of that abdominal wall. That linea alba is the midline, the collagen tissue in the midline, and that stretches kind of like taffy does. So as it gets stretched, and our abdomen continues to expand throughout pregnancy, that linea alba gets stretched and pulled. And for some people, that can even split. And that's when you might see some of those like umbilical hernias, or kind of like an outpouching, especially around there, around the belly button is where I see that often. So that's, so someone might bind or provide or get some external support because they've got that abdominal separation. And then some just choose to do it for a cosmetic. And they want to have those curves back. They want their body to be, that nice corset shape again. So those are the main reasons why someone might think about using a wrap. So then let's talk about what are the types. What do those look like? So there are some that you can get over the counter. That just might be a little Velcro wrap. Some you might even slip into, like it's more of like a one whole band that you just slip into, giving you some support. I do feel that more of the cosmetic ones seem to be like that corset kind of hourglass type shape. There's also the banking belly bind. That's with there's strips of fabric and they're tied or applied in a very specific way. But then I've also recommended sometimes for people, if they feel like they need support, to just get like a high-waisted yoga pant, or, you know, something that has a little bit of compression. Like, I'm not talking, you know, there's yeah, there's some brand of pants that are like practically you need pliers to pull off. We're not going there. This is just maybe a little hug, you know. So those are the different, you know, the main different types of supports. So when should someone use them, is a question. You know, if I get one, like, when should I start? And again, it's not, it really depends on how things are going. Ultimately, these wraps or supports, I say that I tell my patients, it's okay to use them if and when you need it. So I'm not a huge proponent for supporting the cosmetic reasons, because I feel like it's your body needs to heal, and but we want your muscles, your breath, to give you that intrinsic support. That's what that core system is supposed to do. If we're always relying on this external support, or maybe we're relying on it for too long, then it can just slow down your recovery. So at all costs, we really want to try and get our own body to recover and get that support back.
Right. Like pulling it in on its own.
Yep.
Healing on its own, getting strong on its own. Yeah, because if you're wearing that wrap all the time, then your muscles are getting lazy, right?
Mm-hmm. Absolutely. Yeah. But then, you know, there have been times where, let's say you need that extra support. You're feeling really unstable. I have patients come in and they just say, I feel just disconnected. I feel wobbly. Okay. Then I would say, you know what, that's okay. Like, go ahead and give yourself that support. I mean, especially if you're, you know, having to look after a toddler, or maybe it's a little bit later on, and, you know, you're 6-7 weeks postpartum and you're still feeling really unstable or having a lot of discomfort, but yet you need to go to the grocery store. Yeah, go ahead and use it, you know, and that's okay. Maybe it's at the end of the day and you're like, well, I really, you know, I am hurting, or okay, great, you can, not great that you're hurting, but great, like, let's give you this support, and that's okay to use it. I don't want you to sleep in it, and like you said, I don't want you to rely on it 24/7, because then your bodies get lazy, and we want them to come back on board.
So kind of a little common sense. If you're hurting, let's give ourselves a little bit of a break and help ourselves. If we're going to the store, you have a toddler at home, you know, those moments where you need a little extra help.
Absolutely. So I would, you know, I would wait, you know, if you are feeling really unstable, I would give yourself at least 2 or 3 weeks to allow your abdomen and tissues to just decrease in inflammation. There's a lot of changes and recovery your body is making those first few weeks, especially. So just allow that to happen. But again, like I said, if you need to have that support, go ahead.
What about circulation while you're wearing these? I would think that would limit the circulation, right?
Yeah, that's why I don't like to wear them unless you absolutely need to. And then I do, excuse me, with the strips and the binding. I know that you have there's some trainings, there's professionals that know how to do that so that it's not cutting off your circulation or not having an impact on your breath. I definitely don't, I want you to be able to breathe while you're wearing the wrap. And I want you to be able to have good circulation while you're wearing the wrap. So if you're wearing a wrap and you start to lose feeling in your legs, it's too
probably
tight.
not a good idea. Right?
Or if you can't breathe, it's too tight.
You look great, but you can't breathe. Probably not a good idea. Right?
Yeah. So a lot of it is that, like, that common sense, like, it's okay. I want you to use that support. But I use it sparingly, use it sparingly, so things that to help wake up that system. So the reason why you might use the support is because of pain. Your abdominal walls just not, and pelvic floor just haven't come quite back on board. And so here I'm going to give you a few kind of tips that I provide to probably majority of my patients to help wake that system back up. Let's get that your own deep dynamic core system. Let's get it back up and running so that you can feel better and move better. So one of the big things that I use with most everyone is called a blow as you go technique. So that can be utilized when you are getting up out of bed, up and down from the toilet, you're picking, getting up from the floor, anything like that. So what that looks like and sounds like is that you will do this nice gentle nasal inhale, allow your abdomen to gently expand, pelvic floor to drop and open. As you exhale, you're going to connect with that abdomen, drawing your belly button in, and you're closing and lifting pelvic floor. So it's this really nice internal hug, and that's what your stability system should feel like. It should feel like it's this nice hug of support.
I'm doing it right now. I'm practicing it right now.
Perfect.
It feels good.
Yeah, it helps. And I think what that does is it not only wakes up that system, you're actively engaging that core, but it's making sure that you're not holding your breath. Because during pregnancy, yes, our core is getting weak, our abdominal wall and pelvic floor are getting overstressed, but yet we've got the pressure of the baby inside. It's the pressure that's now giving us that stability. Think of it like a balloon.
Right.
So when we give birth, our stability, that short-term, stability system that we were using to move and do our stuff, well, someone just popped that system. It just got deflated. And now your muscles are like, well, wait, you want me to do what? I haven't really worked in the last month and a half, and you want me to do what? So we tend to hold our breath and use that for stability. And that's not a very healthy strategy to utilize. That's when we have issues with leakage or even potentially prolapses if we don't use our breath correctly.
And most people don't. Most people are shallow breathers just to begin with. So just practicing that, like they could even practice that at their desk, right?
Absolutely. I mean, think about how many times we breathe throughout the day. If it's a good breath, that's going to help our system. But if it's that shallow breath, it's just feeding into that fight or flight tense. So it's a simple.
And excellent for people that are recovering from delivery.
Absolutely. Absolutely. And it's something easy. I mean, just what I do recommend is putting something a little bit out of the ordinary within that environment, because we're just going to do what we're creatures of habit. So if it's something where you have, if it's you're getting out of bed, maybe put a little sticky note or sticker, ribbon, something in that area that, oh, before I get up, let me do this blow as you go sort of thing.
Yeah.
Yeah.
Create a new habit.
So that's one of I say, if you picked one thing to do, that would be like the number one thing to do. Another way to get that system back on board is you can do a core bridge. So that's like your standard bridging, your knees are bent, you're lifting your hips up, but how you can engage that core is doing that very similar technique as that blow as you go. You're going to inhale. As you exhale, close and connect with that core, and you lift your hips. And I know some people might be up in arms because I'm telling early postpartum women to exercise. Yes. Yes, I am. Now, I'm not saying like, I want you to do like 3 sets of 20 or go out and run, miles, but think about when you move in bed, what are you doing? You're bridging.
Right.
So why not make it functional? So all I'm saying is, hey, when you lift and move in bed, I want you to exhale so you're not holding your breath. And I want you to engage that core system however you can so you can move safely.
To be effective.
Yeah.
So the movement's effective and it's helping.
Absolutely. Absolutely. And then the other exercise or movement strategy I recommend is a clam. So think about you're lying on your side in bed, snuggling with your newborn. And okay, and now I need to roll over or I need to reposition, so it's your, knees are bent. You're going to use that same strategy, make sure you exhale and engage as you lift that top knee up and down. So it's really, like you said, it's creating more effective movement strategies that help build that or bring that system, that intrinsic stability system back on board.
Right. Makes sense.
Yeah. So those are, if you need that to wear a wrap or support, that's okay. But then I also want you just to try and utilize some of those movement strategies in the meantime, so that maybe you're wearing the support all the time when maybe you start out and you're wearing it all the time when you're up and walking around. And like I said, that's okay. But I want you to start using some of these movements so that, okay, well, maybe I only have to wear it in the evening. And then maybe I only wear it when I have to go out. So I want you to be transitioning and progressing, over time out of that support.
I think that's really good advice, because I do think some of the wraps that you see on the market kind of lead women to think that we need to wear them all the time.
Yeah. And that we don't need to do anything else.
Right.
Like I just need to wear this support and then my abs will be flat and
everything's back to where it was before baby.
Yeah.
Yeah. Probably not going to be the reality in the situation. So
no.
And I like how you're telling women to integrate effective movement while you have to do these positions anyways. We all have to get out of bed, right? We all have to move, and we do certain things even when we're healing after a baby. So make it effective.
Yeah. I mean, even like every time you are getting in and out of the chair after feeding, right? Like think about how many times you would be doing that throughout the day. So if every single time you're just doing that simple, like blow as you go, hey, you're going to start feeling better. You're going to start moving more efficiently and effectively from day one.
Right. And I like that you're telling women to give your body just a couple weeks on its own, right? Just try to blow as you go, do some effective movement, let your body kind of heal and do its thing for a couple weeks, and then use these wraps on an as needed basis.
Mm-hmm.
I think that's wise.
Yeah.
How long do a lot of women use them for? I mean, I guess that's case by case, but what do you usually see?
Yeah, I think it just depends. It depends how they're using it for. So I think that if someone is using that bind more for a ceremonial kind of energetic perspective, they might be wearing that for a couple of weeks. But I think they take it off to wear, take showers and get it rewrapped and things like that. So it really depends, I feel like, on why you're using the wrapper support. But if you're using the support for stability or to help with like that DRA, I want you to use that as needed. And whatever that might look like from day to day, that might look a little bit different depending on the demands of that day. But I also want you to start integrating and activating your own intrinsic stability system using some of those movements that we talked about, in addition to using the support. I don't want you to just put on a support and not do anything.
So a lot of women that come in to see you for the DRA, do they come in thinking, are there women out there that do think that just wearing the belly bind is going to do the trick for them? Do you have to kind of set them straight and say, okay, so here's the deal. We need to do X, Y, Z.
Yeah. Yep. It's like it's kind of like if you have really healthy food and it's just sitting on your counter. Well, that's not going to be very effective, right? Like you need to fuel your body. So same thing. It's that support might be giving you that stability that you need, but as soon as you take it off, you're back at square one, unless you're teaching your body what to do.
Right. Yeah. That's really good for everyone to hear. Well, how many times would you say women that have the DRA need to be in the office, like seeing you for PT?
I would say 100%.
Mm-hmm.
Even, and sometimes I have patients come in that feel or think they might have a DRA, but it's not necessarily a true separation. What I'm seeing is poor breath strategies.
Wow.
They're pushing out through their abdominal wall. They're holding their breath to be able to sit up, to be able to move. So I might not necessarily feel a gap or feel some changes in the depth, but I'm seeing some poor movement strategies that are kind of making their abdominal wall dome or pooch out.
Interesting.
So, yeah.
It's amazing. Like, we've talked about on other segments before how a lot of times we women will just say, oh, that's normal. That's normal. I'll just give it a little more time. Or if it's painful, I'll push through it. So these are things when we start seeing, we will get more effective, not just therapy, but we're going to be able to see the changes in our body and get the help that we need physically if we start doing the effective positions, exercises, breathing, everything that you can teach us when we get in there. So sooner than later.
Yes, absolutely. Sooner than later.
So yeah. Don't push through it. If you're a mom out there and you're listening and you have any of those symptoms, right? Mm-hmm. Call Kim, see a PT for the pelvic floor. And that, I would say, one of the biggest things I hear too are a lot of moms after they've had a baby, they are excited, they go back to yoga, they tinkle a little bit and they're like, oh, well, that's normal, right? Like I had a baby, that's okay. It's not normal.
No, very common. 1 in 3 women will have some urinary incontinence. Very common, but it's not normal, like you said. I feel like any sort of leakage, abdominal doming, vaginal pressure, prolapse type symptoms, painful intercourse, those are all like your body's like check engine light. Something's not right in the system. So get it checked out. It's not going to necessarily go away. And in fact, it could be potentially getting worse. So, yeah.
Well, that's what I was going to ask you. So what about women that maybe they had babies 10 years ago and they're like, well, I thought that abdominal bulging would just kind of go away on its own. I thought it just needed some time. And wow, now I'm looking and it's been 10 years. Can they come in and see you too? Like, or have we gone way too far? And now we have to look at other things. I mean, can you help women that it's been a long, long time and they're like, wow, they're hearing this for the first time?
Absolutely. And I always go back, I'll say, did you see anyone postpartum? And oftentimes it's no. And
Oh,
so,
yeah.
yeah, remember how we talked about all those changes, those physiological and physical changes that our bodies make during pregnancy? Well, our bodies are amazing. It's relentless. It's going to get the job done no matter what, even if it's poor strategies. So yes, you could be able to return to all those things. Maybe you are, going back and doing the stuff that you want to be able to do, but it's a poor strategy. Oftentimes I will see some of those early postpartum changes within rib cage, posture, breathing that have never been addressed.
Yeah, I believe it. My generation in particular, right? My generation, my mother's generation.
Mhm.
So women out there that maybe you just had a baby and you're like, wow, this kind of like could really help my mom, right? It could help me, but it
Mhm.
could help my mom. So they could even
Yep.
get their moms in to come see you.
Yeah, absolutely. I just had a new evaluation, I think a couple weeks ago. She's 15 years postpartum.
See, that's so good to hear because I think a lot of people think, well, it's just been too long. I thought it would kind of correct by now. And, it didn't. So whatever. And they just blow it off where they could come in and actually get some help.
Absolutely. It's never too late. It's
That's
never too late.
that's so good for everyone to hear. Never too soon and never too late,
Yes.
right?
Yes.
Well, Kim, you're going to have to come back on. I want to talk more about all these other pelvic floor issues that women need to hear about. I want us to talk about the Thrive Pediatrics more. That's a whole segment right there because we have lots of moms and dads out there that get frustrated when their kids are wetting the bed and it's not their fault, right? And if we
Yeah,
could have the tools as parents to help them, that's a game changer right there.
it's
So
huge.
yeah. Well, thank you so much for coming on. Tell all of our families that are listening right now, how can they get a hold of you? What's the best way?
The best way is going to be online, which is thrivepelvichealth.com. We've got a lot of great information there. Information on Thrive Pediatrics is there as well. You can even schedule appointments. Another great way to get some information and stay in touch with what's going on at Thrive is to follow us on Instagram, Thrive Pelvic Health. We've got a lot of great content there that can be helpful.
You do. That's an excellent source. Well, definitely, you listeners out there, you better contact Kim Bryant over at Thrive Pelvic because she's excellent and you will be glad you did. So thank you so much for all of your education and awareness that you bring to our community. I'm very thankful and I hope you have a beautiful day and we'll look forward to having you back on.
Perfect. Thanks so much, Jules. I always enjoy our chats.
Me too, Kim. Thanks.
Uh-huh.
Bye. This segment brought to you by Cave Creek Beer Borough. Add a little personality to your next party, wedding, or corporate event. Invite Cave Creek Beer Bros to entertain your guests, arriving in style and serving your beer, wine, or beverage of choice. We guarantee they will be the talk of your party. Check them out at cavecreekbeerborough.com or call 602-505-8559. You'll be glad you did.